Ladies and gentlemen, live on air, Paul Cottrell at the Oppenheimer Ranch Project, as you asked for and as you received. Dr. Cottrell, have you slept?
I did take a nap, so I'm okay.
All right. Well, you just share with me some breaking information, and which is why we're having this podcast, amongst other reasons. And 26 people now have been quarantined in their homes in Westchester County over the coronavirus concerns. Now, I just was sent some information on 712 people in Washington state that are being quote unquote monitored for the coronavirus, but they're not tested and they're not quarantined. So I don't know how that is going to help us beat this infection. And the current numbers 75,186 confirmed, infected, 2,008 deaths. And the infection tolls are rising, as you have seen, the US taking one of the top spots. And I don't even see it listed over here, but we're in China. So, but over almost 30 cases in the U.S. because of the 14 that were flown to Nebraska. Uh, what are your thoughts about what's happening and where we go from here?
Well, I'm very concerned that our country doesn't have a good procedure to stop the outbreak, and this is evident on what you're saying with the 700 that are being quarantined and the quarantine that's taking place in Westchester. We like we said last week, we expected an outbreak. I thought it was going to be in California, but I'm getting a lot of mail and a lot of people calling my show that's saying, you know what, there's a problem. And it's coming from many different sources. One particular source is from the insurance industry when they're processing medical claims. They're stating that they are processing way more upper respiratory and lower respiratory infection claims than they have ever done before. On top, and this has been for the last 3 weeks. This is just not the last few days. And the whistleblower that was on my channel that stated that there are 6 cases confirmed in Buffalo, New York. I called the CDC today through Governor Cuomo's office and worked up the chain there and recorded that whole call. And I got a lot of, dumbfounded, answers, but
All right, you just froze up. So we're going to just talk over you right here. We apologize. But what's going on here, and we're going to break it down for those listening, is that you got inside information a few days ago from someone who works in the medical industry in Buffalo. And it was very believable.
A nurse that works at the hospital.
Yeah, it was very believable.
A nurse that works at the hospital.
I listened to that. And then in the last few days, you've been getting information from insurance adjusters in the medical field that are saying that the upper respiratory infections that are the claims coming in are 4 times a normal flu season. And we're not having a quintuple flu season this year. It's just a normal flu season. So what is going on in your opinion?
Well, I think that we have more Wuhan infected cases than the CDC is willing to admit. And not only that, they don't even seem like they want to test for it now, which is scary.
Yeah.
So I mean, it's just like it's almost as if they want the infection to take hold in our country.
Yeah.
Or they're just totally incompetent, or both.
Yeah, because if 712 people in Washington state are being monitored for coronavirus, first of all, why are they being monitored? And second of all, why haven't any of them been tested? Because if they're out in the community, they could be infecting everyone they come in contact with.
Exactly. It's better to test them now. Here's the problem that I had with the call to the CDC today. And they were basically saying, well, the kits aren't available yet. There's not enough kits, and so we can't do all the testing that we would like to do. We should have been way more prepared. We've been talking about this since January 25th. You're telling me the CDC couldn't get their act together to have way more kits available? If not, that's just another sign of incompetence.
Yeah. Well,
It's just it's crazy. It's
let's
absolutely crazy
let's add,
what is going on here.
let's
You know
add,
that you know what's amazing. Wait, hold on, damn it. What's amazing is that they can say that a biotech company can come up with a vaccine in record time, right? You know, in 3 days, you know, or 3 hours or whatever it was, but the CDC can't get immune assays up and running to do, you know, proper testing in the United States, and it's now 4 weeks. I mean, come on. Something's crazy about the CDC. They're totally incompetent.
Yeah, well, I don't, and think about the incompetence. If there are people being monitored for this disease and they're not quarantined, then the same thing in the US is going to happen that happened in China. There's going to be a slow rollout, a slow
Yep.
procedural rollout, and then they'll all of a sudden be like, okay, we have to, we're going to now say that people have COVID-19 based on pulmonary x rays, which they should be doing now. We already know the protocol. If you have flu-like symptoms
Right.
and you have the if the pulmonary assay comes in from the X-ray that you have fluid in the lungs in a short period of time with a fever, guess what? There's a high probability you have COVID-19, not the normal flu. People with the normal flu don't
Exactly.
generally get hemorrhagic pneumonia, but the people that get sick from this version of coronavirus do, which is why they changed the tactics in China. So how long will it take to change the tactics in the U.S.? And it may be when we have thousands of people that already have it, spreading it around, and then it's go
Mm-hmm. Mm-hmm. The thing is that once you start overflowing the ERs, the primary containment centers, they're going to have to change their tactics because they're not going to have enough kits and they're not going to have enough diagnostic equipment, and it'll overflow into the secondary containment centers, and they're not going to have the medical care that you have in the primary containment. It doesn't take much to overflow an ER system. So
Paul,
you get if you get 6 P4 pathogen cases in an ER in the same day, and they're overflowed. I mean, and the chances are these ER doctors and ER nurses aren't walking around in P4 suit or a level 4 biosuit. So that the chances of them getting sick is highly probable. So we may be seeing not enough healthcare professionals being able to house the ER system.
yeah.
Say 20% of the doctors and nurses get sick from this. They're already strained if they're at 100%.
Yes.
But if 20% of them, are knocked down because of the virus, the system's going to start collapsing.
Well, the system hasn't collapsed in China, but God knows how many of the medical professionals are sick or are not available. But I'm sure they're hiring people on site to do the job, just like they have makeshift hospitals here in this picture set up in sports centers where they just put up cardboard walls here and look at sick people, how protected they are from other sick people. There's literally like 16.
Yeah, I can't see. I can't see the pic. I don't see your screen. If you showed something on the screen. Okay, I can see your screen. Do you like my hair? You like my hairdo? Yeah,
It's almost embarrassing that this is actually the state of the quarantine in Wuhan. This is the Wuhan Sports Center in China. What are your thoughts on that?
Well, this is what they probably would consider a level 3 containment.
Yeah.
A tertiary containment. So, this is important because we have had military personnel call my show, and they have talked about the primary, secondary, and tertiary containment, and the military is the tertiary containment. The primary and secondary are the medical community. But this right here might be what a tertiary containment for us looks like, and it's just asking for cross spreading. So you got to realize that it's not linear. This is a nonlinear thing. As you move towards overflow into a secondary or tertiary situation, your medical care starts to go down. And it's not linear, it's nonlinear. Your care will go down, per step at a faster rate.
Let's talk about the logarithmic curve and the double step and the first derivative and what's happening here on this graph. Can you see the graph, Doctor?
Yes.
Okay, so the first derivative was hit here February 12th, and it leveled off, and everyone thought they were safe. And then they had the readjustment on how they were identifying COVID-19s, and we had this huge spike, bringing it from just around 40,000 to 80,000. And now we're leveling off again. So, and we're back at the first derivative. And guess what happens now, Doctor?
Right, and it's going to jump. It's going to jump. There's going to be a big jump there.
And so let's talk.
And not only that, I think it's jumping for a couple reasons. One is there's a lot of noise in the data set, and incompetence in being able to get a steady flow of data. They're hiding data to really show the true severity of this. But not only that, I think they're playing around with our cortisol levels. Every time you start to see a leveling off, you will start to go back to a parasympathetic state and you'll calm down. And then when you see a big jump, you'll get a spike of cortisol. So they're playing around with our own immune system. Every time you get that spike in cortisol, you're in a fight or flight response. And so they're playing around with our endocrine system by trying to build up fear, then calm us down a little bit, and then they'll build up more fear.
Well, that collective fear building will serve a purpose. And it has been determined through my research that as early as the 1940s, the CIA was well versed on this type of cortisol build and how you can affect the public psyche. So can you talk to why this may be a tactic and what may be actually happening?
Well, I think there's a psychological component, and then there's a physiological component. The psychological component is that they put you in a fear state to accept a solution that they have already pre-manufactured, and which I think is a vaccination program, a forced vaccination program, similar to what happened right after 9/11, where they pushed the Patriot Act, and a pro-terrorism stance in the Middle East, or to fight terrorism in the Middle East. The physiological aspect of it is that they're going to weaken our immune system. So when we do get hit by the virus, we're not going to be at 100% charge to be able to fight it.
Yeah, so take your nutraceuticals, get yourself in tip-top shape, and that's some of the most important preparedness things you can do. Also, I think it's important. What I think is least important in this game, and most people jump the gun on this, is like face masks and stuff. I don't think that face masks are important as people purport them to be, because surgical masks do not protect from the virus. They only protect from spreading the virus. And this is an important thing we need to get out there. N95 masks only can protect from the virus.
Well, we got to be careful that we got to be careful, and you got to protect your eyes too, not just your mouth. You got to remember that Dr. Li, who died in China, was an ophthalmologist, and he contracted it by looking at people's eyeballs. So it's just the eye is a great conduit for getting a viral infection.
Yeah, because it's moist, and this virus is definitely through droplets. So even when people speak, they tend to spit, and you can't feel a micro droplet hit your eyeball. And that's how the easiest transmission is, being in close proximity with someone while you're talking to them without eye protection. You could also breathe it in and it will hit your tongue. You could also breathe it into your nasal passage. But the eye is, as with no protection, if you don't have glasses on, that micro droplet will go and attach directly to the retina. It's immediately in your bloodstream, and boom, you've got COVID-19.
And here's another thing: women that have long fingernails, even if they had a mask on, and even if they wash their hands, they could still have the virus right underneath those long fingernails. And they take off the mask, they wash their hands, they start making dinner, and you know what? They're spreading that virus that's stuck in their fingernails. So it's best to trim those fingernails, and not right now. Don't have long fingernails.
Yeah, take one for the team and suffer for your own health and security. This isn't for others, but it is in the long term, because if you keep yourself safe and protected from this virus, you will not accidentally spread it to your loved ones. Can you imagine someone who didn't take the right precautionary measures in their household, and they had long fingernails, or so to speak, and they were cooking dinner, and then half the family gets the disease? It could be absolutely tragic, because we now know that there is a definite fatality rate of up to 2%, and that's the official number, which is definitely lower than the real number, because they're trying to keep the public from going crazy. And if they're willing to tell us that the death rate is 2%, can you imagine what the actual death rate in a year when we do the studies from this disease actually is?
Right. Well, the historians are probably going to say it's upward of past the 5% mark. How more, I don't know. I mean, we're right in the fog of war right now, and we don't really know what it is, but it's deadly. And people need to realize that, and that some cohorts, when they get this virus, they're going to have problems. They're going to have serious pulmonary, kidney dysfunction problems. That the ACE2 is not just in the lungs; it's in the kidneys, the liver, your vascular system, in your heart. So different organs, even your smooth muscles have ACE2. So your intestines,
that the intestines, the upper and the lower intestines in the villi have ACE2.
Mm-hmm.
So it goes all the way through the digestive tract. Mm-hmm. Now, this paper just came out. We're going to share it with people who watch this podcast below. We have the official paper, and we have the breakdown from Vox. And it's giving us, and this came out yesterday, so it has it has 15,000 of the 20,000 known cases in it. And it's giving us a really good breakdown on confirmed cases and who's most affected. And the most affected age range is very clearly between 20 and 80 years old. So it's a huge spread. Every adult, and the biggest hit is 50 to 59, where over 10,000 cases. So that's the mid-peak for those with the virus. But that does not reflect those that actually die. The people that die from the virus, there is a logarithmic curve starting at 60 years old, increasing towards 80 and beyond. So this is specifically targeting the elderly for death. Almost no one under the age of 49 dies from this disease. Very low percentages. And most of them could be accidental or other underlying causes. So this disease is only a killer based on the stats for 50 and older. And if you're older than 65, you are in a very poor target range. You almost have a 25% chance of dying. If you're over 80, it's almost over 50%. So it's the elderly that are at risk. And go ahead.
Well, there's a few things to take a look at here, because most of this data is coming from the China samples. So one thing is that when you're elderly, you have a compromised immune system because you're just older, and you also have cardiovascular issues and cardiovascular disease through the ACE2 pathway. If infected, could not allow for homeostasis for blood pressure. So you can actually have heart failure. You can actually have heart failure because you're just older on this. But here's a more bigger point that I want to make. Wait, hold on, Diamond. A bigger point that is important to make here. In the United States, there are many people that are unhealthy, even when they're in their 30s or 40s. Diabetes is huge in the United States. If you're diabetic, but no, I know that. But the point I'm making is that once we get it here and it takes hold, it's not just going to be the elderly that is going to have the worst outcomes. It's the ones that have the diabetes and the heart disease at age in the 30s and 40s. So it's based on disease state, not so much age. It just so happens that the disease states are for the elderly in China, and not so much in your 30s and 40s and 50s. But in the United States, our disease state characteristics and profiles are totally different.
So let's break that down for the listener.
So I suspect that the mid-range.
The listener, listen, and let me get to my point because it's important. That the numbers we're getting are from China, where the elderly happen to be more healthy than America because the elderly in China grow their own food organically in their backyard. They eat lots of vegetables and micronutrients. So what we're seeing here is a perfect breakdown. If you had a perfect population of healthy individuals, the older ones are going to die. In America, there's going to be a much different effect. But that's not what I was getting to. I was getting to the fact that I have information coming in from David Dubine that this disease only targets Asians. And we've been talking about it as being a biological weapon. It not only targets Asians, but older Asians. So maybe they designed this disease to get rid of those billions of elderly people that they want to get rid of in China. Because according to this chart here, where this is a chart based on all the scientific papers that have come out that are related to ACE2 receptors, and then it breaks down the genetic predisposition for danger when it comes to COVID-19. And it shows that the majority of people at risk are Asian in descent. And then the second group here is Bengali, Sri Lankan, and Mexican, and then the Caucasian risk is much lower. And now this could be simply skewed based on the infection rate where it broke out, but these numbers in this graph, Paul, are not from COVID-19. They're from all of the scientific papers based on viruses that are more acute to the ACE2 receptor. So this is an independent study, independent of COVID-19, which just shows you the atypical genetic types that would be susceptible to this particular coronavirus. Can you speak to that?
Well, this is another set of data points where we're saying that the ACE2, upregulation is more in Asians and more in Asian males. This is just proof of that.
And so,
but I'm concerned. I'm concerned that I'm concerned that certain disease states also cause upregulation of ACE2.
Yeah, well,
it's not just ethnicity.
Well, listen, and in the last 20 years, and I'm in the U.S. like you, I've been out in the West. I've been hiking all around, and I've met people. And the whole term emphysema has now turned to, what is it? Cops, I don't know what they call it. It's
COPD.
COPD.
Yeah, COPD. COPD.
So there's like almost everyone has COPD that's over 50. They all take these drugs that they inhale, and they're like steroids and other crap. The best bronchodilator on the planet, by the way, is cannabis oil. And if you simply buy a cannabis vape in a legal state, the cannabis oil acts as a better bronchodilator than the actual prescription drug they give you. Not only that, it has no side effects. The drugs that are now being sold for this COPD are deadly, dangerous, and have side effects. But plant medicines have been proven to be some of the best bronchodilators in history. So, and it's unfortunate that we are not on the cutting edge of this plant medicine. We could potentially cure this type of disease using some plant concoction, but the multinational corporations, they cannot patent it because it's a plant. They could make a derivative, which would be less effective, which they have. And so we're stuck between a rock and a hard place. Does the American public rely on the medical system, which they're going to be brought into. And just like the Princess Cruise, we know what a debacle that quarantine and other things can be. People feel like they're being put more at risk now in a quarantine situation because the powers that be don't know what that even means, and they're actually infecting more people. And the type case is the Diamond Princess cruise ship, which is now infected over 20% of the entire ship and now has moved patients off the ship that are infected and brought them into the general population. Princess cruises should be held accountable. We should, as a nation, sue the out of them. We should end cruises categorically because they're just stupid. Let's take a big ship in the ocean where thousands of people shit into a big pot and we dump it right into the tank. Boom. So I think cruises should be eliminated worldwide. But more importantly, we just do not know how to deal with this at this current juncture. What are your thoughts?
Well, I think this is a negative externality of hyperglobalization, where we're too connected. We move too fast, and we have too many things going worldwide, and it's very easy to pass a contagious situation like this. And the powers that be, the health agencies out there should have shut this thing down way weeks ago. They should have shut down travel like this. Why they didn't is because of an economic concern. They use economics over health.
Well, the world,
and that's another reason why I think the CDC is not being truthful to the United States citizens.
No, and the World Health Organization, we've pointed out that they're part of the fraud, and we're looking at a graph now: confirmed cases in China and confirmed cases outside of China. And if you can see, the confirmed cases outside of China is curving upwards and becoming exponential, and that's because of improper protocols. Not because we didn't know about this disease. We learned about it in late December, and we didn't do anything about it until mid-January. And we're still not doing anything about it in mid-February in the U.S., which is why we have a spike. We are repatriating infected people, not using improper protocols. God knows how many people in the U.S. currently are sick and are spreading this disease. And in a week or so, we're going to have quote unquote new numbers. These pricks.
Yeah, I mean, you can almost. I mean, if you watch the mainstream media, you can just kind of sense that something big is going to be happening shortly. They're prepping for it.
Proper prior planning prevents piss poor performance. When 26 people are quarantined in the homes in Westchester, just coming out today, I'm sure you didn't hear about it. Who heard about it out there? Raise your hands. Okay, I don't see any hands. And there are now 712 people in Washington State, quote unquote, being monitored while they spread the disease into the community. Isn't that gorgeous?
Mm-hmm. Mm-hmm. It is strange. It is strange. But you know what's really weird? I found out about this from a viewer. She sent a text, and it was pictures of I think his name is Dean Koontz. He's an author. There's a book that was written in the 1980s. It was called The Eyes of Darkness, and it's about Wuhan 400 virus. And this is back in the 80s. He's going into detail. And there's actually a researcher at the lab, and his name was Dr. Lee. And Dr. Lee was the one that died. So it's spooky how it could be. It's weird how art, predicts reality. Very, very spooky.
It's not spooky, Paul. It's called universal emulation. It's called the Akashic Record. The information that these master artists like Da Vinci and authors like Kuntz are tapping into, it's the Akashic Record. They got that information that already existed and they published it. And we should heed their warnings. And what are the final words to our listeners tonight? And we appreciate you coming on air as always. I know your time is limited as well as your sleep. We love you, Cottrell. And We might even have you out there at LeCon, I heard.
Yeah, yeah. I'm coming out to Lecon.
So let's talk about moving forward. Let's say this breaks out in the U.S. and it's now spreading in the U.S. Uh, how can people prepare? And the way I'm preparing is I moved out of a city, but there are now hundreds of millions of people like you in a city. Do you stay home? Do you quit your job? You can't. You're stuck in that paradigm. So just limit your contact with humans. Wash your hands. Don't touch your fingers to your mouth. Wear sunglasses. I mean, if you don't have to,
Wash your
yeah, go ahead.
wash your clothes. Make sure you wash your clothes, wash your floors. Proper hygiene is a big factor in this.
Yeah, if you've never been a clean person, we're suggesting you be real clean for the next few months. Make sure your hands are clean. And when I say wash your hands, it's a limit. It's a new level of washing hands. You can't just wash your hands like you've always done. A proper washing of hands that will kill 99% of viruses on the surface of your hands requires you to lather the soap into all crevices for 15 to 20 seconds. And that in a human in a current quickening lifetime is just not possible. Most people wash their hands in 3 to 8 seconds, which kills almost no viruses. So we need you to spend a little extra time washing your hands. Just double it. Or say 2 happy birthdays. That's the best way you could do it. And then you will actually kill all the viruses on your hands. Then you can bite your nails or suck your thumb or whatever you do. And you will be much safer than prior. Most people don't know that you actually have to lather for that long period of time. And so when they go in the hospital and they see the doctor, under the sink lathering for all that time, they're like, what the hell is he doing? He's following proper protocol to kill viruses.
Mhm. Yep, you're right. Well, just people need to be prepared, and that the outbreak has probably already happened, and the CDC just hasn't officially told the public. And that's the last few videos that I've been doing on my channel have been focused on the CDC and the cover up.
Yeah, so reach out to your politician in your local area, ask for answers. What will happen if an outbreak occurs in your area? What is the protocol? Will you be locked down in your home? Will you have access to food? How will you survive and thrive if it happens in your area? It's already broken out in Westchester. There may be cases in Washington state. There are 700 people walking free, untested, that are being quote unquote monitored, which is insane to say the least. But the most important thing is that 26 people are being quarantined in their homes in Westchester. If you live in Westchester, New York, or Westchester County, do you know these people? Are you self quarantining? What are you doing to stop the spread of this
Not
pandemic?
only that, there's many. Here's the issue, and a lot of people wouldn't understand this unless they live in New York, especially in the five boroughs. There's a lot of people that go back and forth between Westchester County and into Manhattan. All right, for work. They live in Westchester, but they drive into or take the metro train system, the Metro North train system into Grand Central, back and forth. So this is a perfect way to spread the virus. And so it's not just people just living in Westchester County having to worry about it. It's the commuters into New York City.
Yeah, this is a ticking time
This is a
bomb.
huge problem. This is
This
exactly,
this is a ticking time
exactly.
bomb. This is not the H1N1 flu. This is not the common cold. This may be a biological weapon that got released and it is targeting people. So it's not as deadly as you think. It could be a more deadly biological weapon. But if this is a targeted weapon, we need to take this seriously and we need to contain it because the next derivative is coming and we're going to be exposed to it and they're going to release the information and you're going to have to deal with it. Are you prepared? Do you know what the protocols in your community are? Are you prepared to deal with it? Do you have fresh water? Do you have food supplies? Where do you go from here? Paul,
I'm getting called.
final
I'm getting.
words,
I'm
and
getting called.
make sure these are
Okay. I.
words of wisdom. We don't want to scare the people. We want to prepare the
I'm get.
people.
Yeah. All right. Well, a little bit of it is preparation. A little bit is to scare them to be prepared. But I'm getting calls where the shelves for certain items, certain food items, not all food items, but certain food items and certain nutraceuticals and homeopathic remedies are selling out. So it's time to prepare now. You can't wait any longer, because if you wait much longer, you're not going to get what you need. So you got to start preparing now.
Those types of preparation products that are cheap that you want to get is isopropyl alcohol. It costs 50 cents a dollar per bottle. That's for disinfecting your surfaces. You can purchase the thieves oil. We did a video on it. Todd Kleckner actually developed the thieves oil, the new version for the COVID-19. He sold out in 12 hours. It won't be a week till that comes back online. And he only is going to have 1,000 more units. So only a few thousand people can get that type of, and the rest is sold out. You're waiting on Birch. We're also waiting on some other nutraceuticals here that we purchased that are on back order. So it's important you go out and get what you need now, including food, toilet paper, backup water supply, dry goods. Let's say your community is on lockdown for 14 days. If you have a couple weeks or months worth of beans and rice and canned goods and food, you're going to be happy to be locked down and watch all those old home movies. Otherwise, you're going to feel trapped like a prisoner. And we want to avoid people becoming prisoners in their own state.
Right. Exactly.
Survive and thrive. Proper preparation prevents piss poor performance. Thank you for coming on the show, Paul. Words of wisdom, a final thought.
No problem. Well, be prepared. Be prepared and watch the channels. Because we're really trying to share accurate and timely information to everybody, so they know what's going on, because the mainstream media is not telling you the truth.
Yeah, and if you're one of
And we're putting a lot of effort into that.
yeah, if you're one of the trolls out there saying that we're making shit up or we're lying, that's the furthest. That couldn't be furthest from the truth. We're trying to share this information that comes in. We have insiders giving us information. We're vetting it. We're doing it for your benefit, not for ours. Now, clearly, we're going to benefit by you watching the show, but we're doing the shows to benefit you. Paul and I are people that really don't need your money or your support. We're doing this because we're humans that have a purpose. We love every single day of our life, and we think that this information is important to share with the masses. That's why I give these classes. Paul, am I speaking for you or against you?
No, you're saying the right thing. I mean, believe me, my life was much better before Wuhan coverage than after Wuhan coverage. you know, and I'm putting every ounce of my energy, and it's obvious because people see me exhausted, day in and day out. I'm putting every ounce of my energy into this, and believe me, I had a much better life before all this coverage.
Paul Cottrell, 2024 for president. Be there. Who's your running mate?
Well, you are. You're going to be the VP.
Well, no, I want to be head of environmental security. I want David Icke as the vice president.
Well, what I'd like to do is bring on my brother. I was thinking about putting him on the show, and him and I were going to talk. My brother Joel. Joel is the twin of Dan. Dan is the one that passed away. And, just to introduce Joel to the whole crowd. He has some unique perspectives, and, he served in the military. So he has some, good information about how the military preps for biological warfare.
All right, we'll set that up, and we'll do a three-way convo, and we'll do it this weekend. Let's do it this weekend. So when people want to hear it, they want to be entertained, and they want to learn something. So thank you for coming, Paul Cottrell. We love your presentations, your input, and your friendship. And stay true to your word and be safe.
Yep. Thank you.